Hello. I'm here to guide you through something important, something that could change healthcare for every Washingtonian. This isn't about politics, it's about people, your neighbors, your family, maybe even you. Right now, our healthcare system is like a maze. But what if it could be a clear path instead? What if getting care was simple, affordable, and guaranteed? The Washington Health Trust, Senate Bill 5233, is that path. And in this guide, we'll walk through it together, step by step. No jargon, just clarity. Because when we understand how change can happen, we can help make it happen. Ready to begin? We stand at a historic moment for Washington State. Senate Bill 5233, the Washington Health Trust Act, presents a bold vision to guarantee health care as a right, not a privilege, for every resident. Let's explore how we can build a healthier, more equitable Washington together. The vision is clear and universal. The Washington Health Trust would create a single, public, nonprofit system. Every resident, regardless of employment, income, or status, would be eligible for truly comprehensive coverage. And you could see any doctor or provider you choose. No restrictive networks. What does comprehensive mean? Everything medically necessary. Doctor visits, hospital stays, dental and vision care, mental health services, prescriptions, physical therapy, preventive care, maternity and pediatric services. The full spectrum of care we all need to stay healthy. Crucially, this bill eliminates the financial barriers that keep people from care. For most residents, there would be no premiums, no deductibles, and no copays. It provides full protection from medical bankruptcy. Coverage would be guaranteed from birth and last a lifetime. Why do we need such a fundamental change? Look at our current system. Washington has over 50 different health insurance companies, each with its own confusing plans, rules, and paperwork. This fragmented patchwork creates massive administrative waste that drives up costs for everyone. Think of it this way. Our current system is like having 50 different cell phone companies, each with its own incompatible charger, plan, and billing department. The Washington Health Trust is like switching to one universal, efficient network. It cuts through the sludge, so our resources go to care, not paperwork. The bill establishes ironclad protections. It bans discrimination based on pre-existing conditions, income, immigration status, gender identity, sexual orientation, or body size. It mandates culturally and linguistically competent care for all. This is healthcare with dignity for everyone. The system would be governed by a transparent, accountable public board, a 17-member board of trustees, including health experts, consumers, labor and business representatives, and tribal voices. This board ensures oversight, holds public hearings, and puts patients, not profits, at the center. For hospitals and community health providers, the bill introduces a smarter way to pay: global budgeting. Think of it like a public school's annual budget. Instead of billing for every Band-Aid and aspirin, a hospital gets one predictable, negotiated budget to cover all operations. This lets them focus on patient health, not billing paperwork. The trust would also use its collective power as the largest buyer in the state. It would negotiate fair prices for prescription drugs and medical equipment for all 7 million Washingtonians. An evidence-based formulary would ensure access to safe, effective medications. How is this funded? Through a mix of fair, predictable sources. Employer contributions, scaled by business size. A small capped employee deduction. The integration of existing federal funds from Medicare and Medicaid. And a modest adjustment to the existing capital gains tax for high earners. For employers, this is a massive simplification. It replaces the complex, time-consuming burden of shopping for private insurance. Contributions are scaled, 4.5% for microbusinesses, 6.5% for mini businesses, and 10.5% for standard businesses. It frees business owners to focus on their work, not healthcare bureaucracy. For workers, it means portable, secure coverage. A small 2% payroll deduction, which employers can choose to pay, replaces unpredictable premiums and deductibles. Most importantly, your coverage stays with you, even if you change jobs, lose your job, or start a business. It ends job lock and provides real economic security. This works because of shared security. Right now, health insurance is like being in a small, tippy canoe. If one person gets sick, it rocks the boat for everyone in that small pool. The Washington Health Trust creates one massive, stable pool for the entire state. When risk is shared by millions, costs become stable and affordable for everyone. The bill thoughtfully integrates with existing coverage. It seamlessly brings Medicare and Medicaid into the system. It fully respects tribal sovereignty and preserves the Indian Health Service. And veterans' coverage through the VA remains separate and intact. Implementation is phased and responsible. The board forms in 2026. Enrollment begins in 2027. The system is fully implemented by 2029. It includes strict cost controls, annual independent audits, and a requirement to stay within budget. The result is a healthier, more productive Washington. When people get preventive care, we see better health and longer lives. Healthier workers are more productive, and businesses, freed from the burden of managing health insurance, become more competitive. This is how we build a stronger economy for all. The time for action is now. The blueprint is written. Senate Bill 5233 is economically sound, morally right, and practically achievable. We have the solution. What we need now is the collective political will to make it law. You can help build that will. Contact your state senator and your state representative. Tell them you support the Washington Health Trust Act. Share this information with your friends, family, and community. Join the growing movement for healthcare justice in Washington. A healthier, more secure future for every Washingtonian is within our reach. Together, we can pass the Washington Health Trust Act and guarantee healthcare for all. Thank you.